Hi, my name is Angel Rivero and right now I'm with Dr. Asuncion Fernandez. Hello, Doc.
Hi, Angel.
Meron po ba kayong insight, Doc, tungkol sa mga mag-asawa na nahihirapan mag-conceive?
Well, maraming pwedeng dahilan, no, kung bakit nahirapan sila mag-conceive. Pero kadalasan, the more common reasons would be yung prioritization. So like, women are more career prone or they are more focused with the work that they have.
Yeah. Lalo na po yung mga kababaihan, kapag career-oriented sila, then usually parang, ay hindi, wag muna kasi I'm gonna get a promotion. And then, lalo pong tumatagal yung delay.
Oo. Mas lalong napapatagal kasi parang iba yung nakikita nilang mas importante sa kanila for that particular point of their life. So, para sa couples, kadalasan siguro isa sa anim na couples ang pwede magkaroon ng problema in relation to fertility. And because of that, nagkakaroon sila ng mga dahilan kung bakit nahihirapan sila mag-conceive.
And I can imagine, Doc, na parang nagkakaroon din ng psychological aspect. Na parang maybe nape-pressure din sila. Na parang, I must try now, tonight, or they must try harder. Meron din po sigurong aspeto na gano'n.
Malaking epekto rin ang stress. Alam mo na, pwedeng hindi lang manggaling sa sarili nila, lalo na kung alam nilang parang tumatakbo na yung biologic clock nila. And minsan sa couples din, pwedeng yung partner ang source ng stress kasi parang they have to be able to conceive, lalo na pag, alam mo, pag may mga occasions, malaking bagay yung magre-reunion sila, tapos parang wala pa ba, ganun. So, medyo parang yung iba nahihiya na or naiinis nang pumunta sa mga ganung gatherings, lalo na kung may expose sila sa questions or sa yung comments na parang, ay nako, wala pa rin talaga.
That's right, absolutely. Nai-inherit po ba yung fertility ng isang tao? Like if your mother has a history na hanggang 45, nanganganak pa rin siya, does that mean you have a better chance?
Well, siguro titingnan natin yan sa aspeto na parang sinasabi nila parang may genetic predisposition yung menopause, no? So ibig sabihin kung ang mom mo, or at least kung hindi mo alam kung ilang taon bago nag-menopause ang mom mo, yung pinakamalapit na kamag-anak na babae, kung sila yung tipong umaabot ng mahigit sa 45 or 50, ganyan. So most likely alam mo na may pagkakataon kang pwedeng malapit din sa ganung edad bago ka mag-menopause. So, syempre, pag mas maaga silang tumigil ng pag-menstruate, may possibility din na baka ikaw ay genetically predisposed na maging maaga din ang iyong pagtigil ng period.
When they talk about pre-menopause, Doc, does that mean na you still have a chance of getting pregnant during that pre-menopause stage?
Of course, merong possibility na magbuntis din sila, but kung may plano ka magbuntis, syempre mas maganda kapag mas nasa tamang edad na hindi naman sumasabit dun sa perimenopausal na age. Kasi sabi nga nila, yung pinakamagandang itlog ay nandun sa mas bata na age, and habang tumatagal, alam mo ba na yung initial na mga primordial follicles, yun ang tawag doon, ay nanggagaling, ay nandyan na nung mga 5 buwan pa lang tayo sa loob ng uterus ng mom natin. And then, upon birth, biglang babagsak na lang yon ng, kunyari kung 6 to 7 million yon, magiging 1 to 2 million na lang upon birth.
What happened to them?
Yeah, there's an accelerated loss of these follicles. So, syempre, pag nag-start na siya magkaroon ng period, bumababa ulit yon ng mga 450,000 na lang. And in general, parang umaabot lang tayo ng siguro mga 450 possible eggs na magagamit for the reproductive lifetime. So, syempre, ayaw natin na yung mga last few eggs na naiiwan habang nagkakaedad tayo ang gagamitin. Because this is associated with yung congenital or chromosomal anomalies. Marami na yung tinatawag na aneuploidy, yung hindi na tama yung bilang ng chromosomes during that time. And syempre, yung itatagal ng mga eggs na yon ay hindi na kasing ganda compared dun sa medyo mas bata.
So when you say high risk, Doc, it doesn't necessarily mean na high risk na endangered yung nanay. Pwede ring high risk in the sense na the baby won't be completely normal.
That's correct. Oo. But even then, pagdating kasi ng, alam mo na, pag kunyari mga 35 and beyond, that's the time then that we develop some of the illnesses related to aging. Like, pwede na tayo magkaroon ng acquired diabetes, hypertension. So, older women would tend to have more morbidities in relation to pregnancy. So, aside from the fact na mas pwedeng mas at risk na maaga kang manganak or hindi masyadong yung malilit ang babies dahil nga merong correlation sa mga high risk conditions related to age.
So having said that, Doc, para bang it is of utmost importance to keep your health in tip-top shape if you have crossed 35 and balak nyo pong magkaroon ng baby?
Definitely, oo.
I see. And kapag mag-asawa na po kayo and then nahihirapan kayo magkaroon ng anak, what can they do to improve their chances of conceiving?
Well, of course, kailangan mag-decide sila na hindi masyadong mag-delay ng pag-try to conceive. And then, second, kapag nag-start sila ng maaga, hindi masyadong nakakakaba na they could try yung mga natural methods. Pero pag mga 35 and above, baka mas maganda na mag-consult agad sila sa infertility specialist para naman hindi tumatagal yung attempt nila to conceive.
I see. And then yung hierarchy po ng mga trials nila in conceiving, it starts with drinking medicine po ba to try to activate the fertility?
Well, actually, most of our patients should be able to understand muna what are their chances of getting pregnant. Ano ba ang, because the mere parang advice lang that you need to tell them, hey, you know that the egg will only have a lifespan of 12 to 24 hours and you need to fertilize that egg. It's good if you would be able to know when is that period, but sometimes there's really parang it's less stressful if you don't try to check your app and schedule and parang stress your partner na he has to come home early this time.
Now, kasi it's time.
That's true. So we need to advise them that even the sperm will have a lifespan of 12 to 72 hours, and for as long as they do the contact as frequent as they can, or at least never going more than 3 days of abstinence, then more or less they'll be sure that sperm would be waiting if she has not yet ovulated, or if she has ovulated, then maybe the reinforcement can do the benefit of parang helping out in the fertilization.
So ganun pala, Doc, parang yung gap dapat 3 days or less para tumaas yung chances.
That's correct.
Within the window na malamang fertile yung babae. I see. Ngayon po, kapag they want to take it a step further in getting their fertility treatments, ano po ba yung mga procedures na available?
Okay. So, meron tayong kino-consider na parang parameters na tinitingnan natin para maka-decide tayo which method is going to be best for a couple. So yung una, parang yung female history, and we check what usually associated to with the age. And I think I mentioned that a while ago. So syempre, pag less than 35, parang yung tatlong methods of conceiving, like maybe the simpler method of all natural, meaning we depend on intercourse is the only way for us to deliver the sperm into the uterus. The second one would be artificial insemination, or which is parang commonly known as intrauterine insemination, although there are other methods of insemination. And the third one would be the assisted reproductive technique, or what we call in vitro fertilization.
I see. When you do po, Doc, the intrauterine administration of the sperm, insemination, do you simply put them in closer to the uterus, or is there something that assists it one step further?
Well, actually, we divide that into two parang stages or phases. The first one would be the sperm wash or sperm processing. So after collection, parang di ba initially sa semen analysis, they do the parang centrifugation, and then they let it stand for a few minutes and they make the reading. But with processing or sperm wash, after the initial reading, they they would check the presence of parang gelatinous materials or artifacts, or they're able to process in a way that the dead sperm or any debris would actually be washed out, so that you have a better concentration of the sperm. That's correct. Okay. Yeah. So after the processing, which takes about 1.5 to 2 hours, then this is we go to the second phase, which is the actual insemination. So this time we ask the wife to parang to be positioned like like doing a pap smear. So we do the preparations and just use an intrauterine catheter, which is soft and pliable, and then we place it inside the uterus. So insemination could actually be intravaginal, intracervical, but you know, parang sayang naman yung kung sa vaginal area mo lang ilalagay.
So, all the way na.
Or sa cervix, kasi parang pwedeng mag-egress yun, so sayang naman. So, you place it inside the uterus so that the travel or the distance by which the sperm would go is shorter.
I see. How interesting is that?
Okay, so I think we go back to the other parang parameters that we look into.
Yes, Doc.
And the second one would be knowing the history if a female has actually had a previous pregnancy. Because if this is a primary infertility, meaning she has never gotten herself pregnant, and you have a patient who had at least one pregnancy, whatever the outcome is, whether it's a miscarriage or a parang a full delivered pregnancy, it gives her a better chance compared to another woman who is trying for the first time, and of the same age. So if that's the case, she can go through any of those 3 procedures that we mentioned.
I see.
The second thing that we look into, the parameter which I was saying, is facts of ovulation. So we need to know, is she ovulating? Then that's fine, because she can choose any of the 3. But if she's not ovulating, we don't have to, she doesn't have to be scared, because we can give fertility pills or injections, and she can still go ahead with the natural, the AI, or the ART.
And to find out, Doc, if a woman is ovulating, you do ultrasound.
Yes, there are several methods, but very parang practical way is doing and a more reliable test would be the ultrasound.
Okay.
The fallopian tube is also very important, because fertilization, especially for the natural and the artificial insemination, uh, needs or requires a fallopian tube that's open. So, di ba, we were given naman the right and left fallopian tube,
Yes.
and it is enough just to have at least one tube that's open. Because there are some patients who went through parang tubal surgery, maybe they've had an ectopic pregnancy, but for as long as the other tube is open, then she can still conceive in any of those three.
I see.
However, if both tubes are blocked, then that's a different story. The tubes would actually have the proximal, the middle segment, and the distal part. So yung distal part is actually created to have beautiful finger-like projections that should be able to sweep over the ovary to catch the egg when the ovary or when the egg gets to be released.
Wow.
Yeah. So if the end of those tubes are closed, so no matter how many parang medications you give and how many eggs would actually respond, then the tube would not be able to catch those eggs.
Pero why, Doc, would they be closed in the first place?
There are several conditions that could actually cause that.
I
So
see.
you can have an infection, you can have a previous surgery that has caused adhesions, you can have endometriosis, and the like. So for the distal tubal obstruction, you can do a surgery to open that. But for cases wherein the tubes are closed either proximally, sometimes for as long as there's no parang distension of the fallopian tube, you can go straight to an IVF.
IVF. So these three letters are actually talked about a lot, but many people don't really understand what IVF is. Could you explain in layman's terms, Doc, what IVF is?
In vitro, so we said earlier that fertilization happens in the fallopian tube. But for those cases where the egg and the sperm could not meet in the fallopian tube, then we have to take the egg out and ask the husband to collect the sperm, and we fertilize the egg using the sperm outside
the body.
of the body.
I see.
So-
and then you put it back in.
If the egg has been fertilized already. So the process in itself takes several steps, no? But the goal is for us to be able to get to grow the as soon as the egg and the sperm as soon as the egg has been fertilized, we know that this would show exchange of genetic material, and they cleave or divide into cells, and depending on the preference of the patient and or the doctor, they can transfer the embryo either on the second, the third, or fifth day of the division or the cleavage.
I see. And when you transfer the embryos, Doc, do you do just one embryo, or is it the mother's prerogative to say, I want 3, I want 4?
That's a very good question, because actually, parang globally, they would want a set or a single embryo transfer, because definitely you'll have a safer pregnancy. There's a lower risk for perinatal morbidity, or yung mga preterm delivery, ganyan. So even the risk for hypertension or diabetes is lowered when you have a singleton pregnancy. However, there are conditions where you can actually consider placing more than one embryo. And even the American Fertility and Sterility Society would actually have a recommendation for or a criteria for the number of embryos to transfer, depending on the age of the patient, depending on the cleavage and the grades of these embryos. So parang if you have a very favorable embryo, then you can place only one or maybe two. But if they say all others, meaning some of the embryos may probably have a better chance inside the womb than just freezing them and allowing them to be thawed and see that they don't survive, then maybe they would opt to transfer right away.
I see. And having done that, Doc, there is a possibility na all the embryos transferred will actually become full babies and will become triplets or quadruplets?
Yes. So, for Filipinos, sometimes they would say having a high order pregnancy, meaning if you have more than one, parang to them it's a great thing, right? But for the medical practice, it's actually a complication. If you have more than
This is always like, yay, right?
Yeah.
Okay.
So sometimes you may be happy with having 3, but it's not the right practice.
I see. Thank you so much, Doc. We learned so much.
Oh, by the way, don't forget, because there's a male component
Yes.
in the parang fertility picture. So it's difficult to get pregnant alone, So you need the male.
It is often forgotten na the male also has a stake in this.
Yes.
Na the blame is not always to be placed on the woman.
That's why we recommend that when the couple, when a female, let's say, or a wife would come for fertility consult, it would be ideal for her to bring the husband.
So together.
Yes. Because when you work up the female, it's best to see them both so that they'll have a picture of what is expected, or at least they'd be able to understand and be able to support each other if they would see the whole picture.
The doctor po ba of the man and the woman can be the same doctor?
Well, for reproductive endocrinologists or medicine specialists, the patient should actually be the couple. So it's not just the male or the female, but there are conditions where we actually refer the men to our friendly urologists. So especially if we see that there's only one evaluation, a very simple one for the men, and that's the semen analysis. And there are criteria that would actually tell us if there's a problem or not. Now, if, let's say, a woman has a problem with fertility, and then the male has also a problem, then the male factor could be contributory to about 30 to 40%.
Wow.
Yeah, so it's good to see them both so that you can address whatever problem there is. So if, let's say, the count of the husband is normal, then they can try any of the 3, like the natural, the AI, and even the IVF. But if the count is low, or any of the 3 more important parameters like concentration, motility, and even morphology, then the natural method may not be feasible for them, and they can go straight to either an AI or an ART. However, there are men who would actually have 0 count. Yeah.
How is that possible? Wow.
Yes, but we have partners like the urologists who are also experts in retrieving or at least extracting sperm. And if there's this thing which we call a non-obstructive type and an obstructive type of azoospermia. A means absence, so azoospermia. So if they're able to retrieve or extract sperm, then that collected sperm can actually be used as a fresh collection or as a frozen specimen for future IVF purposes.
Ibig niyo po sabihin, Doc, na freeze rin yung sperm?
Yeah. Interesting, huh? It's good that we can.
Yeah.
Otherwise, we'll end up with more women having problems of infertility. It is best that the men would actually have their sperm analysis or evaluation in laboratories that are that would use the reference value recommended by the WHO. So that the values will not be too discouraging for them.
Right.
So there are times when they come, we would say, "That's just okay. That's fine," and they felt like it was several years ago, and they were feeling bad because they thought that the results were really low. So,
Pero may up-to-date figures naman pala tayo.
right.
All right. Thank you so much, Doc. That's bizarre information.